At the end of the day, it is about the patient. It could be your mother, your father, your sister, your aunt, your uncle, right? A best friend, a neighbor. So what these physicians do really matters and, like I said, save and impact patients' lives and patients' families. I'm in a very regulated healthcare device. I'm not in consumer packaged goods or I'm not in tech, where my company and the entire ecosystem had to make sure that we're on brand, right? We have specific claims, we have data to back that up, and that's important. We try to work with physicians early through their career, through medical education, which is a strong opportunity to have them understand the technology and the disease states as they continue to grow and build their practice. So a physician, like a radiologist, may know how to do a diagnostic and put a catheter up, etc. But the technology from the company, that's always changing, and that's important as well. And that's where we and marketeers come into play to explain why product A is different than product B, right? And it's not just around features and benefits, it's around the value proposition. And how do you do that? Through great storytelling.
Today's guest is Terence Wiggins, a marketing leader at Cordis Corporation. And that's a company that's been at the heart of cardiovascular innovation for nearly 70 years, from the first guide wire to the first drug-eluting stent. Terence is a global MedTech executive with over 2 decades of experience across organizations, including Stryker, Integra, Life Sciences, Terumo, and Cook Medical. And he's led teams of over 50 professionals, directed commercial strategy across billion-dollar portfolios, and overseen more than 40 product launches across 135 countries in the Americas, Europe, and Asia Pacific. I mean, that's an incredible different set of teams. So in this episode, we're going to explore the critical role language plays in driving patient safety across global markets. So interesting angle. And Terence, really good to have you on the show.
Jason, thank you. I'm honored to be here. Thanks for tapping me on the shoulder to give me the opportunity.
Let's get to the first question, and I always like to go into, people's backgrounds and where they kind of came from. But you've had, Terence, something like 20 years in MedTech at Stryker, Integra, Terumo, Cook Medical, and now Cordis more recently. What sort of started you in this world and what keeps you in it?
Well, thanks, Jason. I like to describe myself as a career marketer. As you mentioned, I've been in, marketing, healthcare marketing for 20 plus years. And my marketing origin story actually started off with, even before all those great companies, Bristol Myers Squibb. And I was there at the pharmaceutical company. And it was interesting what they did is they got all their marketers together and built a program around marketing excellence. So imagine just being there, and I got to hear from some of these great marketers, and they were really focusing on how do we drive value propositions? How do we segment? How do we target? How do we drive a tactical plan? And again, I was just a young guy coming straight out of college, and I was like soaking this all up. And I got a passion for it. And so, from there, I went to a small startup that was eventually acquired by Stryker. And then I spent 10 years at Terumo, which was awesome. Got to be able to be on top of a lot of products, manage a lot of products. At some point in my career, I was, head of global marketing for Cook, and that was another wonderful experience. But I'm on to new ventures, and I'm really excited because I think what Cordis is doing and where they're going is going to new frontiers beyond things we've seen before. And I'm happy to be part of this team now.
It sounds exciting. I think that sounds like a really, really good move. But So let's look at the kind of buyer universe. I was sort of looking, and a lot of buyers in some of the stuff that you've been doing are interventional radiologists, interventional cardiologists. I had to look these up, by the way. I mean, that was quite specialist to me. But they are people that are very skilled and vascular surgeons. I mean, interventional radiologists, for the audience, they're just people who kind of use CT scanning and sort of radiology and then do very, very, very low invasive kind of very minute kind of surgical fixes, which is incredibly interesting. Probably not for this podcast. It's a completely different conversation from most marketing leaders. It's very specialized. Thinking of brand, what does that even mean when your audience is choosing a device mid-procedure or, in that sort of world?
I'm blessed to be in the area of healthcare marketing. What that means is, at the end of the day, it is about the patient, right, Jason? It could be your mother, your father, your sister, your aunt, your uncle, right? A best friend, a neighbor. So what these physicians do really matters. And like I said, save and impact patients' lives and patients' families, right? And I'm in a very regulated healthcare device, right? It's unlike I'm not in consumer packaged goods or I'm not in, tech where my company and the entire ecosystem had to make sure that we're on brand, right? We have specific claims, right? We have data to back that up. And that's important. The other piece I want to talk about too, Jason, is, we try to work with physicians early through their career, right? Through medical education, which is a strong opportunity to have them understand the technology and the disease states as they continue to grow and build their practice, right? So a physician, you mentioned earlier, like a radiologist may know how to do a diagnostic and put a catheter up, et cetera. But the technology from the company, that's always changing. And that's important as well. And that's where we and marketeers come into play to explain why product A is different than product B, right? And it's not just around features and benefits, Jason. I teach my team a lot. It's around the value proposition. And how do you do that? Through great storytelling.
I think that resonates with any marketing leader. It's interesting to see that, or to hear that you're doing the same things, even in an incredibly specialist kind of area. It's like you're educating the market early. You've got some programs going out to sort of capture people from a brand perspective really, really early. And then you're building that value, thinking about value propositions and value to the end user. And also from your perspective, it's keeping in mind that the actual ultimate beneficiary of all of this is actually the patient, which is really interesting sort of thing. It's like by proxy, which is really nice. And it lends itself to storytelling, doesn't it? Because you can talk about the human side of what that person is doing. I.e. the patient story, fixing people and all of those kind of things. So I think that's great. It seems to me like a brand, although, Joe Public, myself included, may not have originally heard of Cordis. It's a brand that's indispensable to those kind of specialists across all. And I was looking, it's across something like 70 different countries or 70 plus countries. And they're speaking different languages, maybe even working under different clinical standards, or at least different regulatory standards across, you've got NICE in Europe, I think, and all those kind of things. And the FDA, what is it in the States? I can't remember. I'm not a medical expert, but there's the federal government basically
FDA.
has standards,
FDA,
right? FDA, I was going there, but I wasn't confident, but I was going there. Yeah, so the FDA, you're right. And so how do you make sure that brand carries the same trust and the same authority from, I don't know, Tokyo to Philadelphia, let's say, across the world?
Well, I love that you mentioned Philadelphia. Go Eagles. That's where I'm from, everybody. So sorry if I'm, getting people upset from the Giants and Dallas Cowboys and the NFC East, et cetera. But what I want to say is, listen, what I look at and what in my career, I think about what is the core story we're trying to tell. And again, why is it different? Why is it better? Why is it differentiate? For example, physicians don't have, think of like a grocery store, right? There's a lot of shelf space. If you take something off the shelf and replace it, it better be better than what's there or have some type of differentiating factor. And in the US, right, they have ASCs and OBLs. They may not have, infinite shelf space, even in academic and hospital centers as well. So you got to think about, there's a lot of different decision makers. It's not sometimes just only the physician. It may be the inventory manager, maybe the C-suite of the hospital, and there could be an economic story to tell, right? There could be obviously a quality of life story to tell. There could be an ease of use, the ability to get patients in and out faster because of the technology that you'll be in use. Now, Jason, you picked on something that I think is important because that story does have to change in different region. I have had the experience, the wonderful experience of managing global teams. And what that means is whatever our core story is, it's got to resonate within that region because business in that region may be a little different. So I think what we need to do as marketers, and I would encourage marketers, sales, commercial teams, is really understanding what is that region, what's going to resonate, having focus groups, understanding if there's tenders or, reimbursement or bringing other commercial groups together. So that way you're telling a story that sticks.
I mean, that's really interesting. And I think, when you think about that sort of, so you're getting that kind of local expertise, ideally, and bringing it to the table and understanding local market. And you've got all these different, as we talked about before, there's regulatory approval, different clinical expectations, I guess, and different language requirements changing in those kind of markets. How do you maintain like that global message when those rules, those markets are sort of changeable or different?
I don't want to put your audience to sleep in getting, looking underneath the hoods. There's a lot of ways to do that. I know, just very generally speaking, usually what we have is a claims matrix. So you look at all the clinical data that's out there, and you have it in, sometimes I like to call it the medical device Bible or that product guide, right? And you're trying to understand what's already published out there, what will be published at specific trade show or vascular opportunities or trade journals. And then you also try to drive, all right, for example, your marketing material, your campaigns, your brochures, link back to that claims matrix. A lot of companies do it a lot of different ways. Maybe they may call it many different things, but I think the most important part of that is that cross-functional alignment, right? So marketers, what we want to say, we got to make sure that we connect with our legal team, our medical affairs team, our regulatory team, because again, no one looks great in an orange jumpsuit, right? So we got to make sure that we're on brand and we are aligned, and it's fair and it's balanced, right? So again, as marketers, we have to be very cognizant of the message and bringing our groups along. So therefore, this is the product message that does resonate and is impactful, and it showcases obviously the value proposition.
That's really interesting. And of course, there is a massive downside. You said orange jumpsuits kind of glibly, but there's a safety issue, and it is, it's a heavy thing. You've got to get it right. So let's look at your time at Cook Medical. You led sort of, I don't know, I think I read 40 global launches across 135 different countries. And in your opinion, so from that experience, what does a successful global launch look like? And what do the ones that struggle have in common? Let's take the successful one first, and then we can look at ones that maybe struggle a bit more after.
Great question. And listen, out of the 40 product launches that I've managed in my career and hoping to manage some more, not everything's successful, right? And that's good, because that's where you really learn, right? And when you have a large team, I think it's important to make sure you have roles and responsibilities aligned. You need to communicate that as a global leader. You need to motivate and empower, right? You need to also, I'm going to use the pressure word, right? You need to put a little pressure to make sure that we think outside the box and creativity, right? If we do everything that every company is doing, we're not going to stand out. And that's important to make sure, how do we stand out amongst the noise that's already out there, right? We only have so much time in a day, and we're trying to grab a physician's attention while he's at the scrub sink or he's about to go into a case. And you need to be able to have a very finite story that's clear and easy to understand, that's also concise. But when you ask the question around launches, as I circle back, I think it's important to have, preparing the market, right? Anticipating what's coming. That's a big part of it. A lot of companies do that through social media. I know I have a lot of experience in working through social media and priming the market. In addition to that, I think it's important to prime the internal audience, making sure your commercial team and your leaders and your sales team know, right, the pricing, the product, the features and benefits, the value proposition, what it's coming, from the marketing team and the medical education team and the reimbursement team, right? And what I mean by that is launching a product is not just through marketing. I look at launching as, like in the US, the Super Bowl of marketing, right? There's a lot going on. You want to put on a good event, but you have to involve so many stakeholders to make sure it's on behalf of the company, right? And the company is doing a great job, not just marketing. And then when you look at some of the things around supply, right? That's important. If you could have you can have the best technology, a great product, and a great message, but if you don't have supply, right? Physicians can't get their hands on it, or it goes on the back order. Oh my God, I said the B word. Then you're in a lot of trouble. So you got to make sure people have access to it and they're trained on it as well, right? Because again, we talked about safety. You got to make sure that happens. So those are the things that I think are, and there's a lot more, Jason, but I'm just trying to say, you put in a bottle, those are the formulas that really make a launch versus break a launch. Does that make sense?
I guess when you think about that, part of the second half of my question, ones that struggle, they have probably the thing that's common amongst them is one of those things might not be right. whether it's the B word, as you called it, or it's, supply and, and demand outstripping supply. If you've done a great job, but don't have the stuff to be able to complete the orders, that's not great. So, I mean, it's a fascinating sort of area because I think it's quite complicated compared to something like a tech business where, the supply is the, software as a service in our case, or, and that's just there, the supply is almost infinite because you just log into it, that kind of thing. So it's very interesting. Let's go back to one thing that I really like that you said about storytelling and how that might have to adapt for different audiences. You talked about, the CFO and maybe a surgeon, a patient, I'm really interested in, not only that story that you have to tell that's different, but when those have to then work in 20 or 30 languages, what's the sort of scaffolding, the intelligence that needs to sit around all the content that you're putting out there? Is it simply treated as translation, or is there something more to it that you have to think about?
I think it's important to take a step back, and I look at marketing as an ecosystem, understanding the market and the unmet needs, right? That's a lot of where the homework really comes together. Then the rubber meets the road and the tactical and marketing plan. And the last piece where I think a lot of people forget about, but I think it's important, is to go back and look at, did you do what you say you were going to do? What has changed or shifted because you have launched a product or into the market? And what would you do differently? Right? So an after actions review or performance management or some type of dashboarding that tells you, like I said, what's going on within the market. But when you ask the question around, I think let's go back to that first step of really understanding what is the unmet market need? What's the business opportunity, right? Do you have the strategic opportunities to really make a headwind inside the market, right? Do you have the resources to do it as far as budget and people? Do you have the right key opinion leaders that can help you get your message out there clear? So, and then also, where is the market going, right? If you launch a market, you may have great results year one, but the market may change because there could be some new technology that makes you obsolete. So Jason, what I really think about is, and companies have opportunities through what they call stage gates, right? Getting market readiness, that new idea, to then building the product, then releasing the product. But to simply answer your question, the more time you can really dot your I's and cross your T's in that state, in that really market readiness, market opportunity, the more successful you're going to be when you launch and then you adjust to what's going on in the market.
I think it's interesting. When you go into a market, it isn't just thinking about how you're going to communicate in that market. It's thinking about the kind of bit at the beginning, which is what's the research telling you about that market? What intelligence can you gather at the beginning, as well as the intelligence of speaking the right language and communicating effectively, but it comes after, doesn't it? Maybe that initial thinking of the plan. And I guess when you're looking at AI, I mean, we have to talk about AI. I say this in every podcast. We're almost contractually obliged to mention AI. And why not? It's such a pervasive kind of thing at the moment. I think we should. And it's what people are really interested in. When you're launching across multiple markets at once, so let's say you've got your research, you understand what markets you're going into, and it might be, several, maybe 10, I don't know. How does the conversation about that content readiness need to sort of start? And does AI kind of help that or is MedTech still figuring that kind of thing out?
I think we're still figuring it out. Like I said, I've had the wonderful opportunity to be with a couple different organizations where I've seen the impact of AI, or I guess the early impact of AI and opportunities where it can go. Some companies can go out and partner with other companies like Palantir or others, or they can buy AI packages, right? And make their own sort of ecosystems within AI. And I know companies are doing that. I'm aware of that. As well as marketers are leveraging AI, if through ChatGPT or Gemini or Claude, or again, I feel like it's happening so fast. When I go on to LinkedIn, there's always a new opportunity on how to use AI. Ultimately, I think at the end of the day, as marketers, what I'm hearing from my peer group is we cannot not ignore AI. AI, to me, think about it, 20 years ago when there was Office Suite and you have the Office tools and PowerPoint and Excel, I was actually learning that stuff when I was in college, and now obviously I've been using it. AI is like that tool for younger audiences and also for older generations to really understand it. If you do not, you will be left behind, right? Companies are figuring out ways to use AI to leapfrog in front of other companies, right? And so you need to have a AI strategy, and you need to also figure out where you can do it safely, right? There, like I said, we're regulated, but I think that's important to don't forget about the technology. I think it can optimize it. You can make things faster. You can generate content, but also that last part, Jason, you got to make sure you customize it, make sure it's your voice. I go on LinkedIn all the time and I see LinkedIn posts from folks. And I was like, that sounded like 50 other LinkedIn posts because they're all using ChatGPT or Claude, right? So you got to be able to customize it to make sure it's really speaking your language and your terminology.
That's true of any brand. I think it's your tone of voice has to stay true. You have to feel authentic. I think that's one thing that you need to start working in, which talks to your sort of LinkedIn thing where everybody's putting up loads of stuff. And there's always tells, not just EM dashes, which I think everyone kind of gets, but there's, sentence structure and all of that, which are kind of tells. But it's interesting, nothing more so than in your market where you have to be really careful with it because it's regulated and people's lives depend on it. So in that kind of vein, where or how do you decide? I know you said that MedTech's, thinking about how to use it rather than probably using it at a massive scale. But what would you feel, or how do you decide, or what's the decision parameters where you'd sort of feel comfortable letting AI handle, content or output, let's say, and what still needs, from your perspective, that human kind of eye or the hand on the tiller, if you will?
The high level response to that one, Jason, is one, when you're using AI, be careful, making sure you understand the policies and the rules within your organization, right? You may be dealing with some confidential information, new technology that you don't want to just upload to ChatGPT and obviously have your secrets, right? Your company secrets out there. Like I said, some companies have their own version of it, so therefore it stays locked within their own ecosystem. But if you work for an organization that doesn't, I would just, making sure you understand from your leadership, your management, what's allowed and what's not allowed. Try to ask what their AI policy is. And if you're running a small organization and you're the boss, right? Maybe you're the marketing guy, the owner, the sales guy. Again, I would say, really test it a little bit, right? Because what you're trying to do, as we mentioned earlier, is do something different, not be a part of the pack. If you have a new idea, or if you have some marketing sort of content creation that you need to create, you can use AI to optimize it, but it always, I believe right now, still takes a human to look at it, police it, put it in your tone, massage it before you deliver it. So yes, to answer your question, make sure you really understand your company policies before you start really, going down that rabbit hole. And if you are a smaller startup or a smaller organization where you're the boss, just be careful. There are some benefits, right? But there's also some opportunities that you can be blindsided if you don't know how to use it correctly.
Yeah, 100%. And I think we talk a lot about guardrails and guidelines and things like that, especially when using technology to produce it. It actually can help with that and without losing that authenticity. We're at what I call the mid-show moment. It's the same question usually to anyone. You're no different in this respect. So what's the biggest language fail that you've come across in your career?
It's really just, we talked about authenticity earlier, right? And that is important because you want to make sure you are authentic, but not feeling like you're scripted when you communicate to your internal stakeholders, but also to your external stakeholders too. So when you talk about terminology or language fail, I live in a world where there's a lot of acronyms, right? There's a lot of, big words that sometimes leaders use. I like to simplify it, but I also don't want to come across as, well, that's scripted. But the thing is, I thought about how I want to, what I want to say and how I want to deliver it. But does that come off as scripted if it's so sort of that you think about it ahead of time? So I think about really taking like a syringe and injecting the human in it, right? For example, you could be running a meeting or running a group, and yeah, we all have goals and objectives, but just take a pause. How is this team doing? What matters to you most? And I think what I've learned through reading books and really just practicing it is, Brene Brown and things like that, is really just asking better questions, right? It's less about what you say. It's really about what is really going on. And then also, hey, this is what I think I heard you say. So therefore people understand they're being heard. That's very important to me. And that's something I've been practicing quite a bit.
So in that instance, your biggest language fail is probably not listening properly or asking good questions. It's quite interesting. I think better questions is something that we can all get better at, but is a really useful tool, I think, especially in leadership. We did our homework here at the In Other Words podcast crew, and apparently I'm told that you have a really good Tiger Woods story from your early days, and I just thought you might want to impart that to the audience.
Well, thank you for doing that. You know, I'm wearing a Nike shirt, which I know Tiger Woods is a sponsor of Nike. Sometimes I get you almost look like Tiger Woods if I put on a Nike hat. Jason, I'm glad you asked that question. It's a great story. I'll keep it brief. And if you ever meet me personally, feel free to tap me on the show. That I'll tell you the more longer version of the story. Even before my marketing career, MedTech career, I actually had an internship opportunity with the PGA Tour, Point Vedra, Florida. And it was in 2001. It was a summer internship. So I'm originally from New Jersey. I got a chance this is before, it was summer between my junior and senior year, right? So I graduated, I was moving into my senior year, didn't graduate yet. And I had the opportunity to go down there and be working for the PGA Tour. It was a wonderful opportunity. I think there were about 30 interns at the time. I was the communication guy. So being part of the tour, you have a lot of privileges. One, I love to golf. And I was on that driving range every single time I could, right? Number two, you got to see a lot of the players, right? These are celebrities walking around, right? Mickelson, Elders, right? Tiger, right? And so you get to see them walking around the facility, and I got access. In addition, you got to eat. We're in the mess hall there, right? Where some of the players, have their lunches and their breakfasts and their opportunities. So anyway, we fast forward. It's around, middle of the summer. I'm a month into my internship. I sit it's lunchtime. I grab lunch. I'm sitting at a table with like 5 or 6 of my fellow interns. And it happens to be the Open Championship was probably about a week later. And believe it or not, Duval was a Jacksonville native. He got a chance to meet with the interns. Very nice. And Tiger obviously was everybody's favorite in 2001, right? So Tiger was at the height or the come up of his fame and publicity. And one of the interns was having this debate on who was going to win the Open Championship. Was it going to be Duval or was it going to be Woods? I opened my big mouth and I said, I think Tiger's overhyped and, I think he's not going to do well. And I think Duval's going to kill him, blah, blah, blah. He's going to come in first place and everything. And so as I start to become more animated and more confident, I suddenly see all my interns slowly stop talking. And there was a sense of dread and concern on their face. And I stopped and I said, Tiger Woods is behind me, isn't he? And sure enough, Jason, Tiger Woods was right behind me, listening to this loudmouth 21-year-old talk crap in his house. And thank God he didn't do anything, but he did give me a finger and point me. And I felt like, oh my God, I'm going to lose my job. I'm going to go back to New Jersey. And there's the end of my career. He didn't do that. He was nice enough. He just pointed to me. I pointed to him and I was, I knew to shut up real quick. The tagline of that story, if you Wikipedia Duval, and if you Wikipedia the 2001 Open Championship, Duval came in number 1. That was his only Open Championship that he won. And Tiger was 9th. So I got to think maybe I got in his head a little bit. I don't know.
You did. You're to blame. But I mean, what a fascinating story. And it's funny you moved swiftly away from the PGA and then into MedTech.
Absolutely. I was like, let me just change industries altogether, right? And I saw Tiger a couple times that summer. And when he went left, I went right. So let's just tell you, I was avoiding him at all costs.
So let's go even further away from the PGA and that story with the next sort of set of questions, which are going back to sort of the way you operate in your business. And Cordis, I know, doesn't answer to Wall Street, but you've also worked inside businesses that are publicly listed. And does that change anything about how you operate?
Yeah, I think it does. I've worked for a company called Terumo that obviously wasn't traded on the U.S. stock exchange, but did answer to financial stakeholders over in the Asia Pacific area, specifically in Japan. And even Cordis does, is not available, right? Their finance, it's a private company, but they do have obviously a private equity group that we talk to, and obviously they work with. And Cook Medical, a private organization based in Bloomington, Indiana, right? They don't have to speak to, the Wall Street, et cetera. I think there's a difference in and working for those organizations, right? A public organization, a Stryker, right? A Terumo versus a private or a PE held. I think private and PE held can, guide their own faith and destine their own ship is what I'm trying to say. Obviously, there are demands that is from the leadership team and the things they want to have happen and see. We're all going to work to help with those goals and objectives versus I feel like with a publicly held company, there's a little bit more pressure, right? Because there's a little bit more stakeholders that want to make sure they're getting a good return, right, on their stocks and their investment as well. For me, I've always thrived in high environments, high fast-pacing, high-impacting environment. I try to look at it as, at the end of the day, we want to make sure we have the best message because I'm very competitive myself, right? I do strength finders. Competitive is my number one strength finder. And I want to push my teams, whether it's a private owned company or a public a company. My thought is always, how can we be the best at what we do? That's what I want to, that's thriving. What I always want to do is have the best marketing team or be part of the best marketing team. So therefore we stand out a bunch of the competition. It's not for everybody, right? But it's the how you do it, right? And that's important. And I'm still learning it, right? How do you get the best out of teams? So hopefully that answer your question. I think there's a difference, but again, it's up to the leader and how you position that difference.
I think you're right. It's you're driving, and you sort of drive the same thing, regardless of operational constraint that's caused by how you're structured or owned. So we talked about the people aspect, which is let's talk a bit about infrastructure and maybe some operational backbone technology process with things like content systems. When you're operating across many markets, at what point do you decide you need specialist tools and intelligence and tech infrastructure rather than sort of trying to build it yourself or cobble it together? What's your sort of thinking on that operational sort of backbone stuff?
We go back and we talked about the 3 stages of marketing, right? That market assessment opportunity, then the marketing plan, and then the performance management and looking back and dashboarding. How'd you do? I think a lot of, in the beginning, part of the homework assignment is taking a step back, right? Just because you want or should or have the technology to do something, you have to ask the question, can you do that? Do you have the right resources? And what do you need to win? Right. And you may not have that immediately. I remember examples where I was working for a company and we had a commercial distribution deal. And at the end of the day, I was thinking, I have no budget for marketing. I have no budget. I don't have the right folks to help me, to really the ecosystem to help me. And I don't have the right channels. I worried. I remember not sleeping very well because my management team at the time said, you have the existing budget, you got to figure it out. But over time, I think it's important to not worry, even if you don't have it. It's important to influence and build the big business case, even if you don't have it immediately. Build the business case, showcase to your leadership and your management team how much further you can get to the finish line and maybe over the finish line, right? It's always nice to provide expectations beyond, right? To over exceed expectations. And so that's what we did. Me and my team built the business case and we went and created the ask, and the ask was buttoned up and we got the things. So I would say that, one, build out what you think you need. Make sure you ask for it, right? And you have data to support it. Even if you get a no right now, a no at this point, make sure you ask again, right? And hopefully you'll get what you need. Or I think what you need to do is you need to lower expectations, right? If you can't meet A, B, and C because you don't have D, E, and F, then just say, hey, I can do A and I just need these type of resources. You want to set yourself up to win. And I think part of that is influencing and being real and being honest about your capabilities. If not, you're going to upset yourself and you're going to upset your leadership team.
Yeah, and I think that's good advice. If the business case is solid and you don't get the investment, then you have to manage expectations that you can't deliver what you said you would. So it's fairly good. But let's talk about some success that you've had. And when you were at Cook, you launched hashtag FindCookRed on LinkedIn, which is actually still growing. I had a look, and to 15.4% engagement on LinkedIn against an 8% target, which is pretty remarkable for any campaigns that you kind of run on that, especially for a regulated MedTech company. So can you just tell us a bit about how that came about and what you were trying to do there?
I'm really proud of that campaign, and I'm hoping that we can do it. I can, replicate that at other companies. I'm not wearing red, so I'm not wearing the company colors, but it was actually internal. I remember going to a trade show and meeting it, and some of the employees were all wearing red. And Cook's company colors is, there's two colors. It's a red and it's a little bit of a maroon on the logo. And they were at a time where they were in the middle of launching some fantastic products, but the products weren't there yet, right? So there wasn't a lot of good storytelling to tell. Again, great company, lots of great things that was happening. So I said, well, what we can do is we can get awareness by just talking about the great things the company is doing and the people that are there. There's some great people that work there. And then why don't we just, again, red is a very powerful color and it's a simple technique. Hey, listen, when we're going to a meeting or a trade show or a medical conference or medical education event, why is we as employees just wear the color red? And then we had the hashtag FindCookRed, meaning that you found a Cook employee, ask us what's going on with the organization. There were a lot of great changes that were happening to really help them. And so that really went viral quite a bit. It was trending on a lot of the medical education events. It was trending on a lot of the trade shows, and it grew globally. So if you go on LinkedIn and if you just put in hashtag FindCookRed, you'll see the linkages of events. And, the one story I want to say, two quick ones around the impact of it. I had a physician one time. I was at a trade show and I was behind the booth with 4 or 5 of my colleagues, and I had a physician that was highly acclaimed. He came to me and he said, Terrence, normally I don't visit the exhibit floor and I don't want to be bothered about what's being sold, et cetera. But you guys look so well aligned and professional. I had to ask why. And I said, I told him about the campaign. I said, let me tell you about this new product that's launching soon, or this new product so it was like basically an opportunity to bring them in and then pivot and talk about what are the things you want to talk about. Another quick story, and this is a great example. I was at another trade show and I was, at that point, hashtag FindCookRed started trending and people started knowing about it. And I'm in the hotel lobby about to go to the trade show. And I had my little hashtag FindCookRed, logo pin, and I had my little red tie. And I got a tap on the shoulder from a physician and it says, you must be with Cook. I was like, how'd you know? Right. And it was all the red. And then he was like, I see all the red around. You guys brought so many people. We didn't have as many people, but because we blended in with everybody that happened to wear red on that day, we were peacocking, right? And so I use that opportunity again to talk about the organization. So it can be something simple like that, right? That's not regulated, but to grab attention and then pivot the conversation on what you think is relevant is important. So that's my story, Jason.
I love it. I think it's a great example of kind of you're building out a memory structure from somebody, aren't you? You're giving them something to remember, which is differentiated. It's that idea that they remember you, and then you're mentally available when they come and talk to you. Like that guy coming to the stand, you're actually deriving a bit of interest because he's like, okay, I might be interested in what you're doing now, and I'm ready to talk to you. But you've got that mental availability there. It's sort of classic marketing if you really, really think about it. Fascinating. You talked about, the physicians even. I was thinking about how, you create content with those people who are, they're trained to be precise, and they're probably, and you tell me if I'm wrong, they're probably really cautious about any public statement. So how do you kind of get something authentic from that audience when whether it's a reference or whether it's them engaging with some content or speaking on your behalf somewhere? How do you get that kind of authentic, point of view from them, from somebody who's usually very professionally guarded? I'm sure that you face that much more than lots of businesses because these people are very like, we can't speak to you legally. It's not easy for us to do that. Or there are ramifications, at least if we do, and say something wrong.
I think it's about building trust. It really goes back to that. I'll give you an example. I'm heading to New Orleans next week for a meeting called New Cardiovascular Horizons. And I can't wait to go because I'll be meeting with some physicians that I've built trust in my personal brand of having, 10 years with Truro, 5 years with Cook, right? And then obviously now with Cordis. So they know me, right? And they know that I won't ever put them in a bad light. And I want to work with them to get the best out of, having them using our devices and also their support. But I think, you can provide that. The company can do ad boards, advisory boards. They can contract with physicians as well, bring them into the technologies early. In my past, I've got physician tours that have provided to go to the company headquarters and meet the leaders there and talk about new products. I've done that, more of my recent companies as well. So I think it's about building trust. And obviously you have to understand what their limitations are, right? from their institution, or again, you don't want to come off as inauthentic, right? That they're using this product because the company is paying them. They're using the product because they like they like they know where the company is going. They believe in the company and they believe in the technology. So I think it's really around executive building trust. And again, I've had some great relationships where I've had physicians come to me and say, this product does not meet the needs and here's why. And I've actually used that for my engineering team, and we've redesigned products because of that feedback, right? So it doesn't necessarily be, this is great. It could be, this is not great. And let me show you what I really need. So it's around the balance of trust on both ends.
Yeah, and trust goes both ways, I guess. And if something is going wrong, you'd rather know about it and try to fix it. And that's a very healthy relationship to have with your customer. So, but then let's think about it as we're sort of coming towards the end of our conversation. But once you're getting that trust and they're speaking on your behalf or they're putting out content, different languages, different regulatory regimes that we talked about, but that voice from the clinician is what makes it credible. How from your perspective, how do you protect that voice, the company voice, if you will, as it travels around the world? How do you protect it? That tone of voice we talked about at the very beginning, but how do you keep that?
That's where, I'm really focused in product marketing. So I think of it this way. If I were to translate into Apple, the company Apple, right? There's an Apple brand and you get, whether you like it or you hate it, there's something that's owning a spot in your head around Apple. And then I look at it where I control more of like the iPad or the iPhone or the Apple Watch, right? So I really focus on the product branding and the product marketing with the devices in MedTech. That's the biggest sort of analogy I would make. But you asked something really important, because the brand itself is important. And so therefore you have to have a good branding team that really talks about what is it from a net promoter score, what you want to do and to own a spot in a company's mind. What do you want to be seen as? Do you want to be seen as traditional? Do you want to be seen as innovative? Do you want to be seen as maybe a cost conscious or a cost effective player? And then once you start to understand that, and by the way, you don't know what your brand is until you ask people what your brand is, right? Ask them, what do you think about, and again, I'm going to stay in tech. What do you think about when I say the word Samsung or say the word Apple? And then you start to collect that and you see that story may change in different regions. Same thing with MedTech. What do you think about when I say the word Johnson & Johnson or Stryker or Medtronic or Boston Scientific or Cordis or Terumo, right? And understand where you are in the minds of your customers. You may be excitingly high on the net promoter score in the Americas because of maybe you're launching a lot of new products. There's a lot of reasons there, but maybe not so much in the Asia Pacific countries. So I would say take a step back, understand what your brand is, and then think about it. What do you want to do, right? If it's good, how can you make it great? And if it's bad, how do you make it good?
I guess it's ultimately about tailoring that brand voice for the cultural, preferences of wherever you're going to launch it, which you'll get a little bit in your research, I guess. And as you take it out and get more feedback, you've got to be able to build in that kind of intelligent feedback from your customers. How you communicate with them effectively on the ground might be different from place to place. The messages might be different, Okay, right. We're getting to towards the end. In the spirit of helping other marketing leaders, what is the one piece of advice you would give for another marketing leader about taking a business across the globe for the first time?
Again, it goes back to my storytelling. Be really intentional around the story you want to tell. Some of my inspirations, I read Seth Godin, This is Marketing, This is Strategy, Purple Cow. Another inspirating leader, I think, is Steve Jobs. I know he's no longer with us, but I think he was a marketer, right? He was one of the greatest marketers ever lived. Think about again, I talked about Apple a little bit, but think about the iPod. Sorry. He came out and he said 1,000 songs in your pocket. That's it. Clear and concise. And that's exactly what people wanted. Right? Not this big Sony sort of Walkman device. Think about, you can translate that to medical technology. One clear, precise, concise message, story that people want it. And then you want people to say, tell me more, right? And then you backtrack into that. So if you're new in marketing, really focus on the storytelling, definitely pressure test the storytelling. And make sure you understand it, because if you can get your customer to regurgitate that storytelling, you've won. The game over. But if they're unclear or they're using terminology that is outside of your brand guidelines, then you are confusing them.
I love it. And I think couple that with your kind of diagnosis or kind of research phases, you've got a really, really good way of getting to the right kind of thing in the end, the right kind of story, as it were. So, okay, quick fire, last bit now. What's harder, scaling trust or operations?
Scaling trust. Operations, I think you can outsource. I think you can bring some smart operation people along. But once you've broken trust, it's hard within human sort of connections or company connections, right? When you've broken trust, people remember. If you've had a recall, right, people remember. If you've had a warning letter from the FDA, people remember. So you have to build trust. That is that is cornerstone for sure.
And then a book or a podcast you recommend to our listeners?
So I listen to a lot of marketing podcasts, and I've read a lot of marketing books. So I'm not going to go do that, because I'm sure you can go on my LinkedIn and see some of the things that I'm interested in, or follow me on X. But I would say that I'm reading, my uncle bought this for me because I was going through a challenging time in my life, and it was Mel Robbins' Let Them. And I've read that book, and actually I'm 75% reading it. I'm not done, but it's just around let them and let me, right? I focus on control so much because I want things to be right. I want to win. I want to be competitive. But the key theme is, sometimes when you push, people push back. Sometimes it's just the let go of control. And you know what? My life has been really cool and really fascinating by just letting them, right? So you can look it up. Mel Robbins is a great podcaster. I listen to a lot of her stuff too. But the book, Let Them, to me, is changing my life, and I absolutely enjoy it.
Terence, thank you for a really fascinating conversation today. Really enjoyed it, and I wish you the very best for the future, and stay in touch.
Jason, again, appreciate it. This is fun. Thank you, and hopefully the audience got a little bit out of it today, and they can drive for their changing their practices in the future. So thank you so much, Jason.
It's a pleasure. I'm sure they did.
Bye-bye.
Terence, thank you again for a genuinely enjoyable conversation. I think you opened up a side of marketing that not many of us really ever see, and the importance of getting language right in your world, in the MedTech world, was really a question of patient safety. And that's something I think every global business leader is interested to hear. So thanks again. And that's it for another episode of In Other Words, a podcast from Phrase. I've been your host, Jason Hemingway, and a big thank you to Terence Wiggins for joining us today. If this episode made you think about what your language and content operations need to look like as your business expands into new markets, subscribe on Spotify, Apple Podcasts, or wherever you listen. And if you want to learn how Phrase helps global businesses deliver consistent multilingual content at scale, please visit phrase.com. I'll see you next time. Thanks again for listening.